Okay, thank you everyone for joining our fifth and final event of our Caregivers Lifestyle Series. Today we will be talking about behavioral therapy. And today we have the 5 languages available. So I always like to show this. In the bottom right-hand corner or so, you'll see a globe. And if you click that globe now, you'll be able to switch into the different languages. I'll let you do that. And then also I like to give special thanks to the people who helped make this event possible. First, PTC Therapeutics has been a part of all of our events and has been a big stakeholder in making this possible. Little Brave Ones and Translate by Humans for bringing in the interpretation. Our event follows the same sequence as we've done with the past. We have a short introduction, then we get right into the workshop, and then we spend the rest of the event doing a Q&A session so that parents can ask specific questions about their children. And as much as possible, we'll answer those questions. Any questions we're not able to answer, we can answer those by email at a later time. And I'll just start with maybe Judy, you can go ahead and introduce yourself first.
Hi, everyone. My name is Judy. During the daytime, I am a learning support teacher at an international school here in Thailand. And by evening time, I am working for TeachRare.
And I'm Richard Pullen. I'm the president of TeachRare, but by daytime, I am a middle school principal. And Ivana has been an important part of our program today. She's presenting at the EPSN conference in Prague. So she won't be here at this event, but Ivana has been an amazing person who has helped guide us in making this caregiver series possible, and a big part of TeachRare and the success that we've had this first year. Our guest speaker today is Dr. Rolando. And before we turn it over to him, Judy has a short story that we have about our daughter, and then we'll hear from Dr. Rolando.
So Riley Ann has a rare disease, AADC deficiency. She was diagnosed when she was about 6 months old, and she received gene therapy at the age of 1.8 years old. And she had made so much progress after gene therapy. But we just noticed that over these years, we've seen some behavioral challenges. And even though we're teachers and we're surrounded by great therapists and psychologists, we also encounter lots of challenges because of her behavior. So I would always go into Dr. Rolando's office and he would give me boxes of tissues while listening to me, hearing what I have to say about my daughter. And he has given me great advice to how to help my daughter. And so that's why he's here today. And if you have any questions, he's happy to answer and share. Rich, do you want to say anything?
Yeah, I just wanted to add in just one important thing, that I was so happy to have Dr. Rolando here because oftentimes we're posting on social media all the successes we have with our daughter, but behind the scenes, there's a lot of struggles, and the goals and the current challenges that our daughter has right now is specifically related to behavioral issues. So I find this to be the most challenging aspect of managing our daughter. Even though we're teachers, even though we're surrounded by professionals, there are days where Judy and I are talking to each other like we have no idea what to do, and we feel so lost sometimes. And I'm sure Dr. Rolando will get into some of the nitty-gritty about that, but I'm so excited to have this on a personal level because I will be taking feverish notes about Dr. Rolando, and I know that many in our community will also benefit from this. So without further ado, I'll turn it over to Dr. Rolando. I'll give you a second if you need to switch over your screen, and then you can begin. One second, Dr. Rolando, I think you're muted right now. There you go.
Now you can hear me?
I hear you fine.
Okay. Okay.
There we go.
Are you getting my screen?
Yep, you're good to go now.
Okay. So everyone, hello everyone. It's my pleasure to be with you and thank you for coming. I have a lot of respect for all of you as parents because that's the biggest job, the most important job in the world, and it's the hardest job in the world. And so I thank you for that, and I respect you fully. And the way I see myself is just a partner in working together to kind of talk about ideas, because if you go to a bookstore, you'll find rows of books about child rearing, parenting, and so on. But there's no one book that has all the answers for that particular child that you have in your home. And it's because they have so many wonderful little characteristics, and every day brings new challenges, and whatever worked for you yesterday may not work today. Right? Or what worked for your other child does not work at all for this one. So, and then when you add any additional complications, then you just make the job so much more complex. So my philosophy is to make things simpler, because sometimes understanding comes more easily when you make things simpler rather than make them more complicated. So if you can walk away from our talk today with 3 ideas, that is an incredible good use of our time. If you can walk away with 2 of them, that's pretty good. And if you can walk away with 1 idea, that's a success right there. So I have so much information that I'd like to share, but we don't have time for that. And I think sometimes too much information is not helpful. So we're just gonna see if our talk can trigger something in your mind that you can remember. Yeah. So let me see here. How does this work? I have to click on that. Okay, so that's our goal for today. Can we enhance parent skills for addressing child's needs and managing behavior? So the whole idea is that you are the expert. You are the expert and you are the heavy hitter. Sorry, that's a baseball reference. A lot of people don't know about baseball, but you are the one who can make the biggest difference in your children's life, so much more than any specialist. So if we can, I'd like to share a philosophy that you can continue to use. And when I say child's needs and managing behavior, what I mean, you'll see what I mean by that. But basically, we meet our needs through our behavior, and you'll see what I mean by that. I talked about how parenting is the most important job. I'd like to bring up the growth mindset. We don't have time to go over it here, but I think that's such a critical idea to keep in mind for everything, especially parenting and child rearing, because so many of us often say, I'm not good at golf. I'm not good at cooking, right? I'm not good at math. And you could say that about anything, when in fact, if you have a growth mindset, which is something you can look up later, the growth mindset says, you know, you may be here, but if you keep practicing, then you'll be here. And then you'll be here, and then you'll be here. So it doesn't matter where you are, but if you persevere, you grow your skills and you'll become better and better and better. And that happens because so often we get frustrated with our skills. And if we persevere, then we'll keep improving them. And parenting and addressing our child's needs is no exception. So the main idea that I'd like to share with you is that a parent, although that applies for teachers as well, can be a detective. That is, somebody who observes situations, who looks for patterns, examines what's going on, and tries to figure things out. So you have to be a detective to be a parent, and also a scientist and a problem solver. Because no book is going to give you all the answers. And just when you think you have all the answers, something changes, or they get older, or their new behavior comes up, right? Okay, sorry. There we go. So you have tools at your disposal as a parent. And these tools are your eyes, for example. Observing. Don't forget about how important observation is, because we think we know our children based on their past behavior, but every day is new, and you can see new behavior, and keep your eyes keep your eyes open is a really key issue to keep in mind, because we are so used to listening because as adults we communicate by talking with each other, and we're so used to focusing on words that we forget about observing very subtle behaviors and very subtle movements and things that can give us a lot of clues about behavior. The next tool is our ears. For example, they have found incredible things about even babies crying. Babies have different cries for different needs, and it means different things. And a lot of parents actually develop that skill where they can tell what that cry means as opposed to that other cry. But it's subtle. And so listen to the voice, the tone, the raspiness of the voice. All these things are so important. Also, listen, use your ears to listen. For example, the air conditioning droning on, zzz, that can be really disruptive to some children. And that changes their behavior. And they, of course, a lot of them cannot tell you that until they get older. But having when you're listening to music and the AC is droning on, and somebody's having a conversation over there, and you're talking to your child, that's 4 sounds going on right there. And so don't forget about sound. Touch. A lot of children experience touch in many different ways at different times, and so even that's important. Your feelings and intuition is also very important. I mean, so don't neglect your feelings about things and your intuition, but at the same time, don't think that you have the answer already based on your intuition. It's just one of the pieces of information. And lastly, your thinking skills. Analyzing information, looking for patterns is very important. So we're talking about behavior. So what is behavior? Behavior is simply what we do, but behavior is relative. What to you may be a long time, it may be 10 seconds, but it may feel to you like a long time. And the most important thing about behavior that I want you to remember is this: behavior serves a purpose. behavior may look random, but there's a purpose to it. You may not be aware of the purpose, and the person doing the behavior, the child, may not be aware, but there's a purpose. When a child is going like this, is that random behavior? Unlikely. We just don't know what the purpose of that is. So just keep in mind that there's a purpose to every behavior, and we may not really understand the purpose. Sometimes, for example, we may think that the purpose of a behavior is to annoy the mom or the dad. I'm sure we feel that way sometimes. But that is, be careful not to assume that you understand what the purpose of that behavior is. Okay? So that's what I mean by acting like a scientist. A scientist is someone who observes things, but a really good scientist doesn't assume they have the answers. They have hypotheses, meaning you can have a sense of what you think that behavior, that answer may be, but don't assume that you have the answer. Now, what are the purposes of behavior? There are many purposes. One of them is meeting a physical need, like I'm hungry. That's why I want to go to the supermarket, for example. I may be thirsty. My body may be lacking sodium, for example. I may be cold, hot. I may be sleepy, sleep deprived. I may have to go to the bathroom. That's a physical need. Maybe your gastro system or your circulatory system has a lack of balance that the body may be trying to fill. Maybe there's overwhelming environmental stimuli. Maybe you walk into, some kids, for example, have a nightmare when they walk into a mall with lights and flashing things and people screaming and noises and people trying to think like all kinds of people walking by. That can be overwhelming to some children and adults. To other children and adults, it may be overwhelming for them to be in a room with there are no noises and there's no music, because they're overwhelmed by the lack of stimuli. Behavior can be a response to changes in expected routines or in the environment. Sometimes behavior can be seeking stimulation, right? I mean, we may need more stimulation than we're getting at the moment. And sometimes just going like this can be stimulation. And that can be the purpose of that behavior. But we really don't know until we look at it. We may want to experience mastery. Okay, so let me see. What's next? Another thing that we use behavior for is to manage our emotions. This is a big category. As adults, we're so used to using language to manage our emotions, right? Like when we want to talk to someone, we want to complain by using words. But children sometimes, and even adults, use behavior to manage emotions. For example, we seek control and predictability and security when we feel anxious, like when we reach out to hug our mom and dad. Maybe one of the feelings that we're experiencing is anxiety, needing reassurance. We may have fear, and we may have fear of being abandoned. When sometimes, I'm sure you've seen it, when you walk into a crowded place and you see a child whose parents, even if they're 9 years old, whose parents have walked away to look at something, and for that moment they realize they don't know where their parents are. That's frightening. And so behavior can be a way to manage that. Sometimes behavior can be a way to deal with frustration and anger, to deal with sadness. And so what strategies do we use to cope with emotions? I forgot to say, oh yeah, what strategies do we use to cope with emotions? We can escape, run away. We can seek a comforting location. We can engage with others. And some children withdraw to cope with emotions, and they become silent, and other children act out, right? And that's the problem with having just one book, one parenting book, because we don't know what your child prefers to do, right? Some children seek adults and seek conversation, and that they find that reassuring, and others, they become overwhelmed and they need to sit back and recoup by being alone in a quiet place. Anyway, some of the strategies we use is to come up with a plan to avoid the difficult emotions that we have in the future, but that's usually older children and adults do that. Sometimes a very effective way of coping with emotions is to use language, right? By either talking with our parents or our peers or other people, this is happening, this is how I'm feeling, and that's a way that we can manage our emotions. Or to use internal language, which means having a language inside our heads. For example, oh, every time I go here, every time I see that person, I feel like this. So we use internal language. Children who have underdeveloped language obviously have a hard time managing their emotions. So of course, they're going to act out more. And that's something that is very important to remember, that language is such a useful tool for coping with emotions, and children who have underdeveloped language will act out more. And the problem is, what makes it difficult is that they cannot tell us this. They cannot say, I'm feeling like this. So that's why observation and hypothesis testing is so key, to try to figure out what is going on, what is the need, so you can help the child address it, right? And so, so often when our children are acting out, we blame ourselves, or we become irritated, or we feel guilty that we don't know what's going on, or we haven't been good enough, or that our child has to be like this. And these are we're human. But keep in mind that if you put on your detective hat and you say to yourself, what is going on, right? What is going on that this child is engaging in this behavior? And it's hard to figure it out as this is happening, but keep that in your mind, and then you go back and you analyze what was going on, and that can give you an idea about what it might be, and you can develop a hypothesis as a scientist. And if you have a spouse or a partner in parenting, which not everybody does, there are some people who are raising a child by themselves. But if you have a team, a partner or a parent or a spouse, then you can talk with each other about that, about the behavior. And he or she can say, you know what, last time when I went to the store with him or her, she did this and she did that. And so together you can become co-scientists and co-detectives, and then this is a system that I'm suggesting that you can use. And sometimes it helps to have a consultant who can help you figure out behavior as well. Okay. So we also have an effect. I'm sorry, I couldn't resist putting this picture there. Because every parent has had this experience of having a child engaging in a behavior that is difficult, and it's a difficult situation for the parents as well. But how do we shape our children's behavior, and how can we support our children in managing their behavior? Yeah. Well, we have superpowers. I bet you didn't know you did, but we all do. You have superpowers, and let's go over them right now. This is one of your biggest superpowers is your eyes. What you look at is so powerful for your children. And when you look at them, you are charging their batteries, and you are making them feel wanted, making them feel that they belong and that you care about what they do and how they feel. And so every time you look at them, you are reinforcing a behavior. And every time you don't look at them, you are not reinforcing a behavior. And I'm sure you've all had experiences where if you don't look at them, or if you try to ignore something, they'll ratchet up the level of behavior. Like it's almost as if they're saying, can't you hear what I'm doing? Can't you see what I'm doing? I'm doing something you don't like. And then they figure, okay, maybe I'll scream louder so that they really hear me, And so they ratchet up the behavior, and guess what happens at that time? You do it. You look at them, or you say something, and you say, all right. So what is the reinforcement? The message we're giving them is, if I don't respond, just do it more or louder. Okay? So keep that in mind. I'm not blaming you for doing that, because we're all human, But anyway, I'm getting off the topic here. Fixing our eyes on someone is so key. What's your next superpower? Responding with your actions. What I was saying, like, okay. And then we go over and do whatever. That's a reinforcer. That's a superpower. Another superpower is ignoring, right? Choosing not to look and say and do something about a behavior can lead to it becoming less, because it doesn't work. So, for example, if you want to, in fact, you can do that with adults too, but I'm not suggesting you do it, but you can do it. You can even do an experiment with your significant other if you want to be. Just don't blame me for it, okay? But the things that you look at, the things that you ignore. So a very common interaction between a parent and a child is that the parent is doing their taxes, or they're doing their budget, or they're doing their work, or they're reading that book, or they're studying. They're doing something that is very busy and very important at home. And then their child is over there playing quietly, nicely, carefully, enjoying themselves. And after 15 minutes, they start screaming. So what do? We yell at them, right? We say, I told you to be quiet, that I have this thing. And so what behavior are you reinforcing? They were quiet, playing nicely, and doing what they were supposed to do for 15 minutes, and nothing happened. But the minute they started making noise, then they get an interaction with us. You see? So from the child's perspective, that's what it looks like. So guess what behavior is going to be reinforced, right? Of course, when they're in high school, when they're 20 years old, or when they're 15 years old, then you can have that conversation. And you can say, I'm going to have my Zoom meeting here with the Teach Rare group, but but if you need me, let me know. I'll be ready at 11. Okay, with a 15-year-old, you can have that conversation. But with a younger child, you might want to take a break in those 15 minutes, take a break, walk on over and have a little 20-second chat and say, oh, how you doing? Look at them, pat them in the back, say, oh, do you have to go to the bathroom? Whatever, have a little interaction and then come back. You see, because that's anyway, just a suggestion. Another superpower is giving them time to work through their feelings on their own. We don't have to react to every single cry, every single look of frustration on their face. Sometimes they also need to have time to work that out on their own if they can. But of course, these are just general ideas, right? Which may apply to some kids in a different way. So that's another superpower. So be careful when you show a strong reaction. Another one is touching. At schools, we often have this issue where children who do something really undesirable, such as hitting another child, that's when everybody goes over and says, don't do that. Why did you do that? Da, 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 da. And sometimes they even get grabbed or taken away from the situation. And for a lot of children, that's a lot of reinforcement. So you're giving the child the message that when they do that kind of behavior, they get a lot of people paying attention to them. So as adults, it feels like it's undesirable, but it can be very reinforcing. And the last big one is language. Language is so powerful. So let me, sorry, I'm going to start going a little faster. Is that okay? Okay. Do we still have a few minutes?
Yeah, you're okay on time. You're good to go.
All right, thanks. So language, it's so powerful because we use it so, what's the word I'm looking for? We often use it automatically without really thinking about it because we're so used to doing that with adults, and we love language as adults. But really, how many words do you use? Have you ever counted how many words do you use with children? We say, I told you that I had to go to the store and all you had to do was be quiet, but no, you had to do this, just like your sister. Your sister used to do this. So what message do you want to give your child? What do you want? Basically, it's called word inflation. If you use 100 words, what is the power of each single word? One hundredths, right? And if you use 3 words, what's the power of each word? 33%. So if you want to increase your child's listening, use fewer words and use them more strategically, more powerfully, and explain what you want and what you mean. Because I think it's natural that we keep talking. Another thing that counts is the emotional tone. That matters. And another one is give a clear message. Give a clear message. What do you want? Do you want them to stay seated in that location while you go get her sister, and you'll be right back and you'll be able to actually, I just used too many words already. I just used too many words in my example. All you have to say is, I'll help you. I'm just going to go get your sister and I'll be right back. End of story. And then you say, oh yeah, but and then you go and get her sister. Anyway, I think you understand what I mean. Giving a clear message with fewer words is helpful. It's even more important the younger the child is and the lower their language development. But okay, if you remember one thing about our time today, is this one. Okay? Did you like that cueing? Okay? That's why I put it in red. Okay? This is key. Please remember this. Please remember it. Say what you want to see. Can everybody please say that? I won't hear it, but please say it. Say what you want to see. This is the most important thing, because a lot of times we're so used to saying what we don't want to see. Let me give you an example right now. Stop it. I'm going to give you a direction. Stop it. What? Stop what? Was I telling you to stop writing, to stop listening, or stop checking your messages on your phone, which you might do as you're listening to me. What am I trying to get? Instead of that, I said to you, this is the most important thing, so make sure you remember it. Or I could say, pay close attention to what I'm going to say. I'm saying to you what I want you to do. Because what happens is, when I say, I'm going to give you an example. Stop playing with your phone. What do you have in your mind? What picture do you have in your mind when I say stop playing with your phone? Your phone, right? And stop playing somehow. But it's not a very clear picture. But what picture do you have in your mind when I say, listen carefully to what I'm about to say? You probably have an ear, but I'm focusing you on what I want you to do. When I say to you, we're going to clean up our toys, so take that toy and bring it to me so we can put it away. Okay? I'm telling you what I want to see, instead of saying, what a mess. I can't believe that you didn't I tell you last time that you had to put your toys away? Okay? So if you're a child, what is your next step? Right? Maybe the next step is, yeah, you told me. So then you see, it doesn't go anywhere. But if you say, pick up that toy and bring it to me so I can put it in there, you're helping the child or the other person make a picture in their mind of the behavior you want to see. So you're already pushing them in that direction. Okay, so how do you know what the purpose of a behavior is? We talked about this, doing detective work, being a scientist, doing teamwork, and being practical, right? If something works and nobody gets hurt and it's not illegal, do it. Okay, so what gets in the way of everything we've been talking about? Usually, it's our emotions. We love these kids so much that we feel guilty, we feel anxious, we feel worried, we feel scared, or we feel frustrated, we feel neglected. Like, I love this kid so much, and then they did this. right? And our emotions get in the way. And when we're emotional, our brains don't work so well, right? Guilt is a big one, grief, trauma. And the other thing is kids can push our buttons as well. Kids can push our buttons as well. Our buttons are weak areas that we have in our heart because of our experiences. And children are really good at reading that and can sometimes say things that make us really emotional, because we're human. Just because we're adults doesn't mean we're not human, right? So that's what gets in the way. Remember this when you go into the airplane. They say, take care of yourself so you can take care of your kids. So if you're okay, then you can help the kid, and then you can be patient, and then you can be a scientist and a detective. So this is so important. And if your child passes out after 10 seconds of not having oxygen, but you're there and you put the oxygen, the child will come back. But if you pass out after 10 seconds of not getting oxygen, who's going to help the child? So take good care of your needs so you can help your child. So these are the key ideas, okay, that we talked about today. So that's all I have to say. I'm sorry I went too far. I spoke for too long, maybe. But do you want to unshare you want me to stop sharing?
That'll be good. Yeah. And then we'll go over to our Q&A session. So that was really helpful. Again, I'm listening as a parent and not just as, someone hosting an event. So I found it very helpful. One question that came in, and this came in at the start of our event. I think it's a big question, and let's see if you can tackle this, but it's a great question. The question is, how would you determine if a behavior was developmental or possibly related to a disease or some underlying issue, or does it even matter?
I think it does matter. So let me start there. It does matter because if it's a part of some sort of medical condition, then you may need to have some treatment, right? So I think it does matter. The thing that I think is important to keep in mind, though, is that one single behavior by itself is not necessarily indicative of a big issue. So I think you want to look for patterns of behavior. And if you look at the psychiatric conditions and most of the behaviors are shared. For example, difficulty with, let me just take out a behavior out of the air. Difficulty with eye contact. That is one behavior that we see in many children, but it's not by itself, it's not necessarily indicative of any one diagnosis. For example, children with autism have difficulties with eye contact. But if you look at that behavior by itself, children who don't have anything to do with autism sometimes have difficulties with eye contact. So the only way to look at it is to do what I described today, to look for patterns and to look for different areas. I think the developmental norms for behavior that you get from what is it? What's that word? Pediatricians. They have these developmental norms for behavior and for achieving developmental milestones. I think those are important, very important. But remember that there's ranges of age, right? So children develop those skills within a range of time. And there are also some cultural differences, right? For example, children who are from a very urban environment, sometimes they don't develop their visual acuity or their motor skills so much because they're stuck. They spend a lot of time sitting down, or they spend a lot of time at home rather than running around and climbing and all that. So there's some cultural differences, there's some environmental differences, but basically you want to look at patterns and you want to look at your child's patterns. That's the biggest thing.
Maybe
Yeah.
a follow-up to that was a parent had asked, are you recommending that they record? I think what they mean is write down the data. And I remember Judy writing down data. Is that a good way for parents to find these patterns, is to actually record it, write it down?
I think that's a wonderful way, because you have to be really smart to be able to keep that information in their head. And I've known people who are, but I'm certainly not. And, you know, I find that when you write it down and you look at patterns over time, it really helps, right? Another thing that I found helpful is video. And you'd be surprised if you take a video and then watch it later, the things that you fail to notice, even if you're the one who was there taking the video. So I think video, and nowadays with these things, with these phones, it's so easy to do, right? So I think it's also helpful as a clinician. I can tell you, sometimes parents bring me videos of behavior at home, and it's so helpful, tremendously helpful. Because like you can say to a clinician, a very common one is they have a tantrum or a meltdown. Well, what's a meltdown to you may not be a meltdown to me, or there are different types of meltdowns, or some children have learned meltdowns, you know, where they've seen other children do a meltdown, and then they have a meltdown because it works for them, gets them what they want. So, sorry, in so many words, my answer to that question is absolutely.
I have a question, and I think this is a question that I have asked you before, and just like you to share that here. A lot of the parents always would ask me, the teacher says my child has this type of behavior and they don't like it, and I need to medicate them. So they want to bring their kid to their doctors for medication. And often parents are really nervous about medications. And for me, I am as well. Sometimes I wonder if I need to medicate my child. What would you say about medication, using medication for children with behavioral challenges?
I think medication can be helpful in achieving what the medication helps with. So, for example, children who are very, very inattentive and hyperactive, for example, the medicines that they use are relatively effective for a majority of the kids who take them and who are properly diagnosed. But the medication helps improve their focus, and which is more often the difficulty. Hyperactivity doesn't really, is something that is easier to deal with, but the inattentiveness, it really affects their learning. So sometimes medications for that can be helpful, but the medication doesn't teach you how to manage your behavior. It doesn't teach you how to manage your child. It doesn't teach the child how to develop their organizational skills. You see? So medication is one tool that may be useful for a specific purpose. But it's not, it doesn't teach the child the skills they need to develop. That's the limitation of the medications. If they come up with a medicine that teaches you the skills, I'm going to leave this presentation, run to the pharmacy and get it and start taking it. But so far, they haven't come up with a medicine that actually teaches you the skills. And those skills are what are going to help you the most, because as you get older, as the children get older, as they get into middle school or adolescence, the difficulties with, in this example, the difficulties with self-management will improve by themselves. So however, medication can give you some help so that you maximize your learning potential at a young age while you're developing the skills to manage yourself. You see? But the problem is that oftentimes medication is used to dampen. I don't know if I'm pronouncing. Can somebody say that word for me? Dampen.
Yeah, dampen.
Dampen. There you go. You say it better. To dampen the behavior, to make it less intense. So children who act out will be more, their behavior will be easier to manage. But sometimes that can be a good use of the medication if the behavior is so intense, you see, that the child cannot benefit from coaching or teaching. But I would say that is more often than not. I would just be very careful not to use the medication for the wrong purpose. Because if a child is more calm, sometimes they don't get the coaching that they need. They're just less of a problem for the adults. You're right? And that's what you want to avoid. Because remember, we are going back to our issue that we talked about, and that is behavior has a purpose, right? And the more important issue, rather than damping down the behavior, is why is that child engaging in that behavior, right? And once you understand that, then you can help them so much more than medication.
Yeah.
Right?
Yeah, I agree with you. And I remember when Riley was really young and she had different cries. And I know we have some family online right now that have younger children at home, and they don't speak, and they cry differently. Like, oh, this cry is because they're hungry. Oh, this cry is because they're uncomfortable. But what I would suggest parents do now is that if their child is crying or maybe hitting themselves or trying to show some emotions, what I did earlier on is that I would use pictures like, oh, do you want milk or do you want to sleep? Just let them point to the picture, like what they want. So eventually Riley was able to stop the crying and point to the picture.
So, Judy, if you had given Riley medication to sedate her, that's the word, sedate. Okay, sedate. If you had given her medication to sedate her, she would have been easier to manage, but you would never have figured out what it was that she needed. right?
Correct.
And that she would not have grown in her ability to communicate with you about her needs. You see? So thank you, Judy. That is, again, these concepts about parents being detectives is even more important for kids who have underdeveloped language. Exactly. Thank you, Judy. That was very helpful.
Thank you.
And thank you, Dr. Rolando. We're reaching the end of this, and I just wanted to give a special thanks to you for bringing out these big ideas for parents to have a better understanding about behavioral therapy. Each child's unique, and obviously, from an educator standpoint, we always want to build these partnerships with parents. And the more data that parents can bring to us and to their therapists, the better we can all work as a team to help our children. So I think you gave us some very good tips. And when you talked about growth mindset, I feel like we could have had or we should have a future session specifically on that. So we've reached the end of this, and thank you again, Dr. Rolando. And I just wanted to share for our community that we are ending our Caregiver Lifestyle Series with 2 events, one event in Boston and another event in Taipei. Those details will be shared out to our subscribers, and anyone can join these events from any rare disease or special needs. And we're hosting these as a culminating event to talk about all of the topics that we had talked about these last 6 months. And it will also be a time for us to just meet face to face and have some fun as parents. We always appreciated everyone sending our events out, sharing our events. And we will also have this event on our website to kind of summarize everything and to also share the video. So thank you all for joining. Thank you, Dr. Rolando. And thank you to all of our caregivers out there who are a part of this 5-part series.